Joining us right here is the author of World War C, Lessons from the COVID-19 Pandemic and How to Prepare for the Next One. It is available wherever you get your books on October 5th. He is Dr. Sanjay Gupta. How are you, sir?
I am doing great, Rich. It's wonderful to speak to you again. And yeah, I would be absolutely happy to help. Let me know, not just because of the oath as a doctor, just because I'm genuinely happy to help.
No, I appreciate that. You're referring to, Jason Feller, our sound man.
Yeah.
You've got broken back,
spinal.
It's
a mess.
I appreciate you doing that. He's handled. Although I'm concerned that he's having surgery tomorrow and he's doing his pre-op literally right here on the show. To be honest with you, I'm not a doctor, nor do I play one on TV. But anyway, thank you for joining me.
Good luck, Jason.
Thank you for joining me here today. I appreciate it. So, where do we stand right now on the virus and the way things are trending as we are sitting here right now towards the beginning of October? Dr. Gupta?
I think there's some positive signs in terms of trends, but we're trending in a positive direction from a pretty tough spot. I mean, a lot of hospitals in the country are very full right now. When you look at some of these ICUs, 30, 40, some places even 50 or 60% of patients are COVID patients that are in these ICUs. So that's a lot of patients that, are taking, the bed space of what would otherwise be elective operations and other things that, patients come to the hospital for. So there's just hospitals are not really designed to have these huge sort of standalone surge capacities. So when you suddenly add that many sick patients to the mix, it's a problem. Cases seem to be coming down in some places around the country. That's good. Hospitalizations are sort of high, sort of plateaued, but they may be coming down. And deaths are still, they're still high, but these are all sort of lagging indicators. Overall, I'm optimistic a bit that cases are coming down. We've seen that in other countries around the world. But I sort of think about this, Rich, like my own patient. I mean, the patient's still in the ICU, but there's some favorable indicators, but we still got to keep a close eye on things.
And when you say in your book, Lessons from the COVID-19 Pandemic and How to Prepare for the Next One, what do you mean by the next one, Dr. Gupta? What do you mean by that?
Well, I'm not someone who likes to create fear where there's not fear, and I'm not trying to suggest that. But I think if you talk to most people who are infectious disease doctors and who are viral hunters, virus hunters in these places, they talk about the fact that these pathogens, such as this virus, they keep making these jumps from animals to humans. It happens all the time, and the vast majority of them are harmless. But as you increase the number of jumps that happen, the possibility that one of them turns into something that is a virus that can spread easily among humans again, like this did, is higher. So most people say, we used to think about pandemics almost in these 50-year cycles, right? 1918, another one in 1969, another one in 2019, which is this one. But most people seem to think that we will likely experience this again within most of our lifetime. So it's a little bit hard to say, but that's sort of the purpose of the book. Why is it happening? What can be done about it? And even if we can't stop new pathogens from entering our lives, they don't have to turn into a pandemic. And I think there's been a lot of lessons learned here from societies all the way to the individual level.
Well, a difference, I guess, between the previous pandemics to which you referred, Dr. Sanjay Gupta, here on the Rich Eisen Show, World War C, is his new book, The Lessons from the COVID-19 Pandemic and How to Prepare for the Next One. The difference between the previous ones and this one is that in previous ones, there weren't a whole host of folks putting out misinformation in a device that you could see in the palm of your hand instantaneously. Right. And so there is a different way of trying to combat things or swat away what might be the wrong way to combat things. How do you, as a healthcare professional and somebody on TV with a platform, deal with all that?
It's been probably the most difficult part of this whole thing. I mean, I think when you're a science reporter, I've been so head down in this, Rich, for the last 2 years. I'm reading scientific papers coming from journals all over the world. I'm trying to decipher it. I'm trying to be able to explain it to an audience that's not reading these journal articles. make sense of it for people. But I think, a good percentage of the time, maybe close to half the time, I'm also just hearing something that is a bad piece of information and then having to fact check that. And sometimes you hear bad information and you're like, well, where did this even come from? Am I missing something here? And then I have to go and start doing all the homework, taking me down these rabbit holes that don't amount to anything, and it ends up being a significant, amount of time that's sucked up doing that. I think, I have long thought about this idea that, the best way to combat misinformation is to continue to provide good information, explain it well, put it out there in an engaging way. I think there is a difference, I've learned, Rich, between misinformation and disinformation. That's perhaps been the most surprising thing. Misinformation has been around for a while. If you go back and even look at 1918, which I've done historically, look at newspaper articles from that time, there was a lot of people who were spreading misinformation then as well about the virus and whether or not it was a true pandemic and was it a hoax. It is much more ubiquitous now, as you point out, because of social media and everyone having a phone. But it was there before. That sentiment was there before. I think what is different now, it is so strategically disinformation. It's designed to create distrust and chaos and that sort of thing, which has befuddled me. Like, if you tell people, like, if I search on my computer for a new car, I might start getting a bunch of Ford ads. I get that. They're trying to sell me a car, right? But when people are trying to get you to not do something that could potentially, be beneficial for your health, who's inspiring that? They're not selling you anything. The only thing they're selling you on is distrust and chaos. And that's a really hard thing to focus on because it's nebulous. It's just sort of out there with no clear source.
Well, the thing that frustrates me, if I may, Dr. Sanjay Gupta, is, is the misinformation that I see or those who are seeking information, let's put it this way, those who say they are seeking information about whether or not to get vaccinated. Mm-hmm. And, I can understand people who are not fully, made available to them, that people don't have top of the, line healthcare professionals at their beck and call. That's a lot of people who don't know who to trust. They don't have somebody that they can reach out to if they have questions about whether or not to get vaccinated, right? And then I sit here and I hear star athletes who do have literally in front of them and phone calls that can be made to anybody on the medical staff associated with professional sports teams in the country still have questions about all this, saying that they're looking for information. So if you don't mind, I'm going to utilize my time here with you by forwarding to you some of these star athletes' questions and have you answer them right here on the Rich Eisen Show, if you don't mind, Dr. Sanjay Gupta. And first up is one of the best in the NBA, Bradley Beal of the Washington Wizards, right in the nation's capital. And COVID protocols kept him from representing this country in the Olympics. This is what he had to say at Media Day on Monday.
Every player, every person in this world is going to make their own decision for themselves. I would like an explanation to, people with vaccines. Why are they still getting COVID? If that's something that we are supposed to highly be protected from. Like, that's funny that, it reduces your chances of going to the hospital. It doesn't eliminate anybody from getting COVID, right? So is everybody in here vaxxed? I would assume, right? So you all can still get COVID, right?
We're less likely to die or go to the hospital.
Okay, but you can still get COVID.
So the question, the last one we're saying, but we're less likely to be seriously ill or go to the hospital. And it's like, but you still get COVID. So I'll give you the floor. He would like an explanation. Please, Dr. Sanjay Gupta, the floor is yours.
The whole point of the vaccine was to save people's lives, reduce the likelihood they get sick, and decrease the transmission of the virus. In that order. And I think when people think about vaccines, they often think about the vaccine as a sort of completely bulletproof vest. And it's not. Nothing is. I mean, there's nothing that has that level of certainty. What I think people sometimes don't realize, even when it goes talking about all these other vaccines, that the idea that you could potentially still carry the virus in your nose and your mouth, not likely to get sick, but still carry it, is true. That is true. That's not COVID, the disease. That's testing positive for coronavirus. We talked about getting COVID, as he mentioned a few times. That's typically referring to someone who actually is getting sick. Now, someone who's been vaccinated may develop symptoms. Those are called these breakthrough cases. Some people who have breakthrough cases may have no symptoms, or they may have significant symptoms, but usually not enough to go to the hospital. The same person, if they got COVID, if they were tested positive for the coronavirus and they were not vaccinated, you could basically say the level of illness that they would have would be greater. So someone who was sick, not somebody who's going to get admitted to the hospital, now becomes someone who gets admitted to the hospital. Someone who is sick in the hospital but going to recover now could be someone who dies. It's really that simple. I think the level of expectation is, hey, I'm only going to take the vaccine if you can guarantee me that I'll never test positive for the virus from here on out. That's not something that any medical professional should say, because that's not the case. But what they can tell you is that 95% of the people in the hospital with COVID right now are unvaccinated. That should tell you something. What they should tell you is that in places that you have high vaccination rates, hospitalization rates are remarkably low compared to what they were before the vaccine. Death rates are remarkably low. The vaccines work. That's incredible. A lot of people didn't think we'd have a vaccine by this point, if ever. There's some diseases for which we don't have a vaccine. We have it. It works. It's safe. 6 billion of these shots have gone out around the world. He should take it, and he should take it for himself. But he should also know that if he were to test positive for the virus, the likelihood of him testing positive and transmitting it would be significantly lower because he's vaccinated. So do it for himself and do it for those around him.
Next one, Dr. Sanjay Gupta, comes from the world of the National Football League. Cole Beasely of the Buffalo Bills, in responding to a letter, a fine letter that the NFL sent to one of his teammates during training camp, Isaiah McKenzie, because he was not wearing a mask. He retweeted that saying, "Don't worry, they got me too, but I was wearing a mask when I was in close contact with fully vaxxed trainer who tested positive and still got sent home. So what's the point of the mask anyways? Meanwhile, I'm here still testing negative and can't come back. Make it make sense." So he asked a question there. I give you the floor on that, Dr. Sanjay Gupta.
So he's asking, he had an exposure to somebody who was tested positive for the virus.
But he was
wearing a mask.
And he's unvaccinated, correct.
He's unvaccinated.
He'd like to know what's the purpose of the mask anyway if he's wearing it around somebody who tests positive and he's not positive. What's the point of wearing a mask, is what he said.
I'll say two things. I mean, a lot of these are based on this idea of I want a level of certainty when I do these things. If I wear a mask, I want you to now be certain that I am not going to spread the virus or contract it. If I take the vaccine, I want to be certain. And if you don't give me 100% certainty, I ain't going to do it. There's nothing in life that is certain. It is all about reducing risk. So what I will say about masks is the greatest benefit for someone like him is in that if he has the virus and may have no symptoms at all, totally asymptomatic, feels fine, but let's say he has it still, he could be spreading it. That is the biggest benefit of the mask. When I wear a mask every day, every week in the operating room as a surgeon in the OR, I am wearing a mask so that I don't inadvertently contaminate the patient that I'm operating on, spread something to the patient I'm operating on. It's called source control. So again, when he wears the mask, it does provide him some protection, but the vast majority of the protection is for those around him. If he's asking about the fact that a fully vaccinated person spread the virus to him, yes, it is possible. It is possible. That we know that the vaccine works really well at preventing that person who spread it to him from getting sick, but it is possible they could still carry the virus, as I mentioned, and potentially spread it. A lot less likely, but still possible.
Last one for you from Major League Baseball. Chris Sale, who will be starting for the Boston Red Sox this week in a very important game against the Orioles. He's missed some time this year. He tested for COVID positive twice now. In response to him not going to the hospital each time, he mentioned he's still unvaccinated, saying they were checking in on me every day, meaning the healthcare professionals of the Red Sox, who, by the way, I should mention, helped me out when I was a breakthrough case in the city of Boston over the summer, and they're dynamite at Mass General. He said they were checking me every day, making sure I was all right. Quote, I work hard to maintain a good diet and exercise routine, and I take vitamins every day. So I was prepared for this. In the end, it worked out. Does having a good diet and an exercise routine and taking vitamins, is that something that would actually be helpful in keeping you out of the hospital and potentially having a fatal reaction to COVID? Dr. Gupta.
Absolutely. I mean, it's an important point, and one that I think does not get discussed enough. Certainly not in the throes of a pandemic. What is the personal responsibility in terms of health, and how much can that help you keep you out of the hospital, keep you from getting really sick? I mean, we know, for example, in the United States, we're a country that got hit very hard with this virus, and there's all sorts of reasons for that. But one of them is that we are generally a less healthy nation than many other nations around the world. Heart disease, diabetes, obesity, chronic kidney disease, chronic lung disease. All these things were significant risk factors, and in the United States, we have some of the highest rates in the world of some of these diseases. So absolutely, your personal health can tremendously mitigate how significant this disease will affect you. But I also, what sort of strikes me is that we oftentimes think about this in terms of best case scenario, worst case scenario, life or death. And there is this middle ground here, which I don't think people fully realize. You'll see a perfectly healthy person and you get COVID and you recover. What we're seeing is that a significant percentage do have these lingering symptoms. And it may not be as specific as, I still can't smell. But it may be, as I've talked to many patients, I need to take a 2 to 3 hour nap every day that I never had to do before in my life. I get headaches that I didn't used to get. I have a pain that just hasn't gone away, a level of inflammation in my body. There's a lot about this virus that we still don't know. So bolstering up your own immune system, being as healthy as you can, of course. And I even get more specific in the book about, even your microbiome and really understanding how your gut health is so integral to your immunity. We don't talk about that stuff enough, and I can, talk a lot more about that. But the vaccine is one of these tools, again, not a perfect tool, but a really good tool toward preventing him from getting infected, preventing him from having long-haul symptoms, preventing him from getting very sick as well. And he also would do it for himself, but also to help protect those around him. So it's possible to do both and to have the level of protection that we really need to get to in this country.
All right, before I let you go, Dr. Sanjay Gupta, what does this virus look like next summer, next time we have a football season? What do you think this looks like? Best you can crystal ball it for me. What do you think?
I think that we're going to be in a much better spot. Even sooner than that, Rich. Okay. I mean, the thing is that what happens ultimately is that, you get about 55% of the country vaccinated. There's a lot of people who are getting their immunity in a much tougher way right now by getting, infected.
Yes.
And we're seeing the consequences of that. The hospital where I work is totally full. I go and talk to the CMO and I said, hey, just out of curiosity, if I get in a car wreck on my way here just now, how tough would that have been for me to get care here? And he just kind of looked at me. He's like, this is bad. We might have to divert you to another hospital, another city, possibly even another state, because we just don't have room. That's what's going on when you say, hey, look, let's just get a bunch of people immunized through natural immunity. It does work. If you have COVID in the past, you probably have some immunity now to getting it again. Not perfect. As you just mentioned, somebody had it twice. But because of that natural immunity and because 55% of the country or so right now at least is vaccinated, we will have a lot of immunity, I think, going into the spring of next year. And it'll help us. There could be a brand new variant that sort of escapes the immunity, and that would be a problem. But if that doesn't happen, then I think we're going to sort of go the way that things went in 1918, 1919. We have now surpassed the death rate from that terrible pandemic 100 years ago. Granted, the population of the world was a third of what it is today, but still we've surpassed that death rate despite having ICUs and vaccines and all these different things. But when we have enough immunity out there, I mean, the numbers will start to go down. Hospitalization rates will go down and death rates will go down. And at that point, I think as a society, it'll still always be there, but we move on. It's COVID will be part of our lives, but it will be an increasingly less consequential part of our lives.
And hopefully we learn lessons. So the next pandemic, as you say, that we might endure, that we're ready for it and better prepared, as you write in your book, World War C, Lessons from the COVID-19 Pandemic and How to Prepare for the Next One. Dr. Gupta, thank you for the time. And if you just want to have any fun, tell Jake that you also agree that Die Hard is not a Christmas movie, and tell me what he says. Would you please do that? Tell Jake
You
Tapper
got
that?
it.
Okay.
You definitely. And Rich, go blue.
That's
4-0.
right.
We'll take it.
4-0. Wisconsin, big game at Wisconsin. Big
I
game.
know. I keep my emotions in check when it comes to the Wolverines, but I'm allowing myself to dream a little.
Oh my gosh! If there's a vaccine for the Ohio State game, let me know. Okay, will you please?
Hey, we didn't lose to Ohio State last year, Rich.
That's right. That is true. You take care of yourself. Thank you.
You got it. Thanks.
You bet. Everybody, check out Dr. Sanjay Gupta's new book starting on October 5th, wherever you get your books. That's Dr. Sanjay Gupta on the Mercedes-Benz Vans phone line right here on The Rich Eisen Show. Hey, you watched all the way to the end. Thanks for that. Watch more right here.